posteriorly by the tip of the coccyx, and laterally by the ischial tuberosities. It is divided by imaginary line between the ischial tuberosity into the anterior urogenital triangle and posterior anal triangle. The perineum, it is a part of the pelvic cavity below the pelvic diaphragm, as I said, and it is divided by the imaginary line between the ischial tuberosity to the anterior urogenital triangle and posterior anal triangle. The anatomical borders of the perineum. Anteriorly is the pubic symphysis. Posteriorly, the tip of the coccyx bone. Laterally, inferior pubic rami and inferior ischial rami and the sacral tuberosities ligament. The roof is the pelvic floor, and the base is the skin and the fascia. And which this picture, you can see the urogenital triangle, anal triangle, and the anatomical border of the perineum. First, the anterior urogenital triangle. It is divided by the perineal membrane, which is attached to the boundaries of the perineum, as I said before, the ischial rami, inferior ischial rami, inferior pubic rami, and the sacral ischial tuberosity. And this membrane separates the urogenital triangle into two parts. First, the superficial perineal bulge, and it is defined as a potential space between the perineal membrane superiorly and superficial perineal fascia inferiorly. What is about the content of the superficial perineal bulge? First, what is called the ischiocavernosus, the maintain the glitoral erection. Second, pubocavernosus contributes to the release of the secretion from the Bartholin glands. Superficial transverse perineal muscle contribute to the perineal body, and the Bartholin glands, vestibular bulbs, clitoris, branches of the pudendal vessels and nerve, and urethra and the vagina transverse through the superficial perineal bulge. The deep perineal bulge, it is a potential space between the deep fascia of the pelvic floor superiorly and perineal membrane inferiorly. And what is the content of the deep perineal bulge? First, compresses urethra, urethral vaginal sphincter muscles, external urethral sphincter, parts of urethra and vagina, branches of the internal pudendal artery, and the last dorsal nerve and vein of the clitoris. The posterior anal triangle. The anal triangle is the posterior half of the perineum, and it is divided by the perineal by the imaginary line through the ischial tuberosities. Anal triangle, it is bounded by the coccyx, sacrotuberous ligament, and the theoretical line, as I said, or imaginary line between the ischial tuberosities. The main content of the anal triangle are the anal apertus, the opening of the anus, and the external anal sphincter muscle, voluntary muscle responsible for the opening and closing the anus, and the ischioanal fascia fossa, this is the ischioanal fossa. The posterior anal triangle. The anal triangle is the posterior half of the perineum. It is bounded by the coccyx, sacrotuberous ligament, and the theoretical line between the ischial tuberosities. The main content of the anal triangle are the anal apertus, it means the opening of the anus, and the external anal sphincter muscle, voluntary muscle responsible for the opening and closing the anus, and ischioanal fossa. The ischiorectal fossa or ischioanal fossa is wedge-shaped space located on each side of the anal canal. The base formed by the skin. Medial wall is formed by the sloping of the elevator ani muscle and the anal canal. Lateral wall is toward by the lower part of the obturator internus muscle covered with pelvic fascia, as you can see in this picture. The content of the ischiorectal fossa or ischioanal fossa. First, the dense fat which support the anal canal and allow it to descend during defecation. Second, pudendal nerve and the internal pudendal vessels are embedded in the facial canal. And the three is the pudendal canal in its lateral wall. The inferior rectal vessels and the nerve crossing the fossa to reach the anal canal. The external sphincter consists of the many parts. First, the subcutaneous part, which encircle the lower end of the anal canal, and second, features of this part, there is no bony attachments. Second part, superficial part, which is attached to the coccyx behind and to the perineal body in front. And the third part, which is the deep part, which is encircles the upper end of the anal canal, has also no bony attachments. The puborectalis muscles and the fiber of this muscle, the two elevator ani muscle, blend with the deep part of the sphincter. The external sphincter and the anorectal ring, the internal sphincter, deep part of the sphincter. The anopuborectalis muscles, or what is called the anorectal ring, which felt on rectal examination. By the rectal examination, you can felt this part of the anorectal ring, which consists of the internal sphincter, deep part of the external anal sphincter, and the puborectalis muscle. And this the male genital trunk. I mentioned it in the previous lectures. And thank you for your listening about this short lecture about the perineum.